Next speaker is Dr. Liz Mary Santosh. Real world experience of switching to aflibercept in PCV cases refractory to other anti-VEGFs.
Our study was on the real-world experience of switching to aflibercept in PCV cases refractory to bevacizumab and ranibizumab. I have no financial interest. So there were a lot of newer anti-VEGF agents are being introduced with the hope of increasing treatment interval, reducing the treatment burden, and also to have better visual acuity gains. Prior to the use of advent of aflibercept, most patients diagnosed with PCV had limited anti-VEGF options, and a prolonged use of these agents often led to a possible tachyphylaxis. So the aim of our study was to evaluate the real-world visual and anatomical outcomes of PCV patients who were switched to aflibercept due to persistent disease activity after long-term treatment with bevacizumab or ranibizumab, and to compare the number of injections required during the course of each treatment. So this was a retrospective EMR review of PCV cases from January 2014 to January 2022. So angiographically confirmed cases of PCV who had received at least 3 injections of intravitreal bevacizumab and ranibizumab and continue to show persistent disease activity, either clinically in the form of hemorrhage or OCT in the form of persistent fluid or a drop in vision, were switched to aflibercept 2 mg on a PRN basis, and having at least 12-month follow-up were included in the study. The patients who had undergone photodynamic therapy or had any other vitreoretinal disorders that might interfere with the macular structure or function were excluded. So the patients were evaluated at 4 different time points: at baseline, which is at the time of diagnosis. Then the patient was started on the initial drug, either bevacizumab or ranibizumab, and then just prior to switch, then 1 month post-switch, and last follow-up. So the parameters analyzed were the BCVA, intraocular pressure, fundus examination, a detailed spectral domain OCT, and the OCT parameters analyzed were the central macular thickness from the ILM to the RP, the maximal height of lesion at the that is the retinal thickness at the maximal height of the PED, the PED height, the presence of IRF, SRF, and the number of injections received during each treatment course was analyzed. So total of 14 eyes of patients aging from 64 to 84 were studied, of which 8 were male and 6 were female. So then the patients were on bevacizumab, the initial injection, for a period, mean number of at least 25 months plus minus 19 months. A mean number of injections received during this period was 7.57, and the patients were on aflibercept for at least 20.71 months, and the mean number of injections received during this period was 6. So the trends of change in vision, the patient had, during the course of the initial injection, the patient had a slight drop in vision, and just post-switch, there was a significant improvement in vision, and there was, up until the last follow-up, the patient had a better acuity than the baseline visual acuity. The CMT change also showed similar trends. The CMT was almost maintained, almost the same during the initial course, which dropped drastically post-switch, 1 month post-switch, and which dropped further up until the final follow-up. The maximal height of lesion also was progressively increasing during the course of the initial treatment, then showed a drastic reduction post-switch to aflibercept, and which was maintained up until the last follow-up. The height of the PED also was progressively increasing during the initial time of bevacizumab or ranibizumab, and showed significant improvement 1 month post-injection, and which was maintained up until the last follow-up. So the patient was on in the initial treatment for a mean number of 25 months, and the mean number of injections received during that course per year was 5.19. And post-switch, the patient was followed up for another 20 months, and the mean number of injections per year during post-switch was 4.01. So this is a representative case of an angiographically diagnosed case of PCV, and at 2015, at diagnosis, the patient had the initial picture, the first OCT image, and October 2020, just prior to switch to aflibercept, the patient had persistent disease activity and a progressive disease. In 1 month post-switch, there was a significant reduction in the PED height and the disease OCT parameters of the disease activity. And 2 years post-switch, after 8 injections of aflibercept, after a 24-month follow-up, the patient almost had a completely dry macula. So our results suggest a significant improvement in anatomical outcomes post-switch to aflibercept, which was maintained over a mean period of 20 months. And this trend was almost shown in the BCVA, and it was maintained up until the last follow-up. And there was a modest reduction in the number of injections required per year. So even on a PRN regime, post-switch to aflibercept, the results were favorable in terms of anatomical and visual outcomes. So there was a similar study over a 6-month follow-up, which showed a similar result. This was a retrospective study. There was a low case number, but with strict inclusion criteria. Our strength is a 20-month follow-up post-switch. These are my references.